of calories in your diet that came from fat? The shocking results were that the greater your calories from fat, the less likely you were to have heart disease. Chapter 25. Lessons from Dr. Bosworth. How to grow your HGH Mother Nature's way. Baby boomers, I am sorry. Your generation paid the highest price. At the age of 30, you were told to eat low-fat food or you'll have a heart attack. You listened to this mantra throughout your life. Now you're in your 60s or 70s. Your fear of fat is solidly wired into your brain. Do not eat fat or you will die. Oh, snap. I am so sorry. This was the wrong advice. I'd personally like to apologize on behalf of the medical establishment for how poorly we have advised you. You have had more surgeries than any previous generation. The medical industry talked you into over-medicating thanks to the packaged truths about those drugs. We've opened your hearts, got you on statin meds, and stented your arteries instead of teaching you how to fix your troubles the correct way. Instead, we should have taught you to manage your body chemistry, not reroute your blood flow. In your remaining decades, I offer you the secret to course-correct your body: growth hormone. One hormone can reverse every crime conventional medicine has done to you: growth hormone. Human growth hormone's mass media popularity started when bodybuilders injected it with the promise of mighty and lean muscles. This touchy little chemical does not work optimally when swallowed. Human growth hormone, or HGH, must be injected. That scares off most of my patients, but not bodybuilders. They use this drug with great success to grow muscles. That audience consumed this drug, and soon they shared trade secrets with Hollywood and the like. Take a look at the latest movie starring a big, buff, cut actor or a sleek, lean actress. Chances are they got their physique courtesy of HGH. Attend a Broadway or Las Vegas theater show? Look carefully at the lean, strong dancers or flying acrobats. That's HGH in action. For 20 years, I've heard the desperation of patients trying to lose weight. The answer is growth hormone. Wait, before you rush out and shoot up with growth hormone, finish reading. This chemical compound provides a good answer for much of your middle-age problems, but it is tricky to dose properly. Let me teach you how to get your body to produce more growth hormone. That's right, trigger your body to squirt out more growth hormone. Endocrinologists, physicians who specialize in hormones, are thrilled about HGH. It fixes everything wrong with a middle-aged, overweight, slightly depressed, low-energy person. Growth hormone reverses your age, the anti-aging cure. My medical school textbooks taught me that growth hormone decreases as you age. After age 50, your body's HGH production slows to a trickle, never to rise again. I am here to tell you that's not true. You absolutely can stimulate your body to make more growth hormone at any age. Before we go into that, let's review exactly what growth hormone does. Growth hormone. Say it out loud with me. Growth hormone. You got it. It makes things grow. This hormone is produced inside your brain, in your pituitary gland to be exact. Like many other hormones in your body, the chemical structure of growth hormone begins as a fat. As you were developing through childhood and adolescence, this hormone told your muscles and bones to grow. Growth hormone was critical in transforming your body from a child to an adult. Naturally, the body cranked out its largest amount of growth hormone during puberty. HGH seeps out of your brain cells during sleep. Your grandmother's wonderful advice to you when you were a teenager about getting lots of sleep was spot on. Well-rested teenagers produce the most robust growth hormone of all, and they produce it best while asleep. During your adolescent years, if you want the best developed body, get deep, predictable, sound sleep. From puberty onward, your body produces less growth hormone. Measuring growth hormone in the human body is quite difficult. HGH only lasts for a few minutes in the bloodstream. Competitive athletes take advantage of this. They inject HGH into their system, knowing the sports doping police won't be able to measure it. Naturally, your brain squirts a burst of HGH into your body every night right after you enter a state of deep sleep. Typically, This is 6 hours into the sleep cycle, or around 4 o'clock in the morning. Once in your bloodstream, HGH begins a cascade of other reactions. First, your liver releases a substantial sugar dose into your bloodstream, causing you to wake up. Subsequently, HGH gets to the business of what it's doing best, stimulating growth. It grows the following cells: immune system, skin, hair, liver, bones, nerves, muscles, and many more. To supply fuel for all this growth, HGH triggers fat cells to open up and empty their stored energy. In comparison, this is the opposite of what insulin does to those same fat cells. In the presence of growth hormone, your storage cells release fat into your bloodstream. HGH improves your overall energy by freeing up stored fuel. It revs up your metabolism, brightens your mood, and suppresses your appetite. It also boosts your sex drive. What a great drug, right? Conversely, low HGH causes fatigue, decreased stamina, depressed mood, decreased muscle mass and strength, thin and dry skin, increased fatty growth, slow thinking, and decreased bone density. Can you see why this hormone is perfect for every middle-aged person looking to reverse the effects of aging? At this point, you're probably asking, why don't people just shoot up HGH? Hold on, don't do that. Hijacking the squirt gun for HGH has some serious consequences. Those experts I mentioned earlier, called endocrinologists, they know what they're doing. These super smart, specialized doctors have tried many ways to get the HGH formula exactly right. When they overshoot and inject too much hormone, bad things happen. Overshoot, and you'll soon become a moody, pimply diabetic with high blood pressure and an enlarged heart. Not to mention, men start to grow boobies. That's not a joke. That's real. Their breasts go from boy breasts to milk-producing girl breasts due to the excess HGH converting to estrogen. That extra estrogen also shrinks their testicles. When HGH dosing is not correctly calculated and timed, the effects can be gnarly. Although teenagers depend upon growth hormone to lengthen their bones, the adult bones are fused and can't grow any longer. However, too much HGH in an adult morphs their face bones into a Neanderthal-like look. Overshoot that HGH and their forehead thickens and their jaw bones overgrow. Additionally, a poorly timed injection of HGH into adults will cause mood swings and pimples that flash you back to your teenage years. Too much HGH at the wrong time, and you can take a perfectly decent Dr. Jekyll and awaken the evil Mr. Hyde. Also, injecting HGH for unapproved purposes is illegal and expensive. Mother Nature does a brilliant job. It turns out nature does a way better job squirting the perfect dose at the right time to give you all the awesome benefits without breaking the law, draining your wallet, and accidentally morphing you into a raging monster. How do we get this fantastic hormone that melts your fat away, increases the strength of your muscles, concentrates the density of your bones, boosts your energy, erases your wrinkles, focuses your brain, improves your memory, and sparks your libido the 100% safe and natural way? The answer is fasting. Take a deep breath. It's not the end of the world. Fasting isn't your enemy. Granted, I don't bring this up to patients until they've been in nutritional ketosis every day for at least several weeks. Sometimes we wait months. If a patient tells me how little they feel hungry, I might ask that patient to fast sooner. This advanced education about growth hormone and fasting promises many benefits. But if I broach this subject too early in the patient's education, they do not believe me. I know you told me this, doc, but I didn't believe you. I just don't have the hunger I used to. Remember, hunger is caused by your blood glucose fluctuations. You feel less hungry when your glucose levels remain stable thanks to ketosis. Entering the second or third week of ketone production, patients find they unintentionally skipped a meal for the first time in their life. Telling patients about this before they experience it has not been rewarding. They thought it was impossible. When in your third week of ketone production, I encourage you to try and eat one meal a day for 2 days. Have a nice, high-fat, low-carb supper. Eat until you are full. No snacking after supper, Go to bed if you feel like eating. When you get up the next morning, have black coffee without food. Pick a busy day to do this. Allowing your mind to be distracted from food is one of the keys to success. If anyone offers you food, say these words: "No, thank you. I am fasting today. Please don't tempt me." Seriously, practice saying those words out loud. They work like a charm. Drink water or coffee. Put a few of those pink Himalayan salt crystals in your pocket for easy access. If you experience a wave of hunger, put one of those salt crystals on the tip of your tongue. Then pause. Listen. Listen for the shift in what that salt crystal does to your system during a fast. Take that moment to honestly assess what happens. I have learned so much about my own coping skills in that tiny, reflective, mindful moment. Most often, you can get past waves of hunger and get to supper without eating any calories. This sounds crazy when you have not experienced it before. For years, this was an impossible task. So impossible, I couldn't imagine it. A body fueled on glucose does not miss a meal. You get